Whoa! Slow down there, cowboy. You need a medical exam? I see that. I see you seem a little bit hurt, little buddy. Give me just a second. There you go. Now I've got my doctor equipment on. And I'm ready to take care of you, Sonic. Now, what's been going on? Oh, you're kind of like all over the place. I see you gotta calm down a little bit there, buddy. You're a little jittery. Did you get into the sugar? Okay, I see. Well, let me check out your heart, and then I've been thinking, going over your past medical records, maybe we should do a quick evaluation for ADHD. What do you think? Yeah, I mean, because you are all over the place. Are you finding like distraction with some of the missions that you're doing? Oh, sometimes you find that like your controllers aren't working at all and you like zoom off even though the person presses the right button, you just go off the track for no reason whatsoever. It's not that you and your games were poorly designed. It's that you're unique and special. Exactly. You just don't have very sensitive controls. That's okay. We've all been there. Look, my controls are mega out of whack, okay? I am all over the place. People press a button and I go the opposite direction. It's like that mushroom on Ness's head that reverses the controls. That's my whole life. So it's okay. It's gonna be just fine. You are going to be okay. Alright? I am very excited to take care of you today. And I think one of the things that I'd like to do for speedsters like yourself, magical, fast hedgehogs, there is a kind of new audio therapy. And I think that we can kind of integrate that in while we talk about our ADHD situation. Okay, let's listen to your heart first. And now, because you are pretty sensitive, and you hear really, really well, because, it's important, when I put these on and I listen to your heart, you might hear some different things, okay? And I'm going to try to go fast to keep up with you. I totally understand that you're kind of in a hurry all the time. It's all good. You're going to be just fine. Alright, let's listen to your heartbeat, okay? Just listen to your heart a little bit. Just a little bit. Shh. So warm to the touch. What have you been eating lately? Let me scribble it down. I'll just scribble down what you've been answers so we have a good medical record for you. What have you been eating lately? I see. Wow, that's a lot. Have you been particularly hungry? Yeah, sorry about that. He gets a little bit antsy. A little bit antsy. Alright, are you hearing a lot of things? Oh, let's see. I want to make sure you don't have an ear infection. Just make sure you don't have an ear infection. Let's go ahead and listen. Well, we're not going to be listening, but I'm going to go ahead and check. I'm going to go ahead and check in this side, in this ear. I'm going to go ahead and look at this beautiful long, just right up here. Move these little spines out of the way. Okay, perfect. And then over on this side, just kind of move these spines out of the way. Okay. You are a spiky gentleman. Your ears look clean. I don't see any erythema, exudates, or edema, and I also don't see any sign of tympanic membrane bulging. Let me look inside your mouth. What about inside your mouth? Let's take a quick look at your eyes. Let's take a quick look at your eyes. Just a quick look at your eyes. Go ahead and just look at my nose, look at my nose, look at my nose, look at my nose. I'm gonna actually look in your eye, to see if you're under nerves and kind of swelling, checking your fundus. I need to make sure that your phobia looks nice and clean, and I'm looking to make sure there's no common spots or there's something tiny exclusions and little blood vessels that go behind. Same thing on the side, making sure there's no swelling. The optic nerve, make sure I visualize it clearly. I'm trying to see and make sure that the phobia is actually nice and clean and look at the layers, I look at the layers, I get perfect. And I'm following with my eyes. I'm following some of your little blood vessels to make sure that they look good. No, you eat a lot, but your metabolism is very fast, and we're not really worried about things like diabetes. In somebody like you, although it is possible for type 1 diabetics to be very thin like yourself and move very, very quickly. So, and of course, even hedgehogs can get diabetes. It's just very unlikely in you with the amount of exercise that you have. They did one study that found that exercise was equal in humans to metformin, and metformin is our best first-line drug for diabetes. So exercise makes a really big difference. I'm very happy with you. Some hedgehogs, dogs, other species that end up living with humans do end up suffering diabetes because humans feed them too much carbohydrates, not enough very clean food. Animals and people, we're all supposed to be getting lots and lots of meats and vegetables, but we put a lot of filler in our animal foods, a lot of corn, especially high fructose corn syrup in our people food, and just corn filler and all these other things in our animal food. And so hedgehogs who come and live with humans are at a greater risk of diabetes, and since you've been around humans for a while, it's just a risk, but you're looking really good because you maintain that exercise so well. You just maintain that exercise so well. I'm just looking at your mouth. So what I'm looking for here is I just want to make sure that you're here. Can you go ahead and say off for me? Say off, thank you. That moves your tongue out of the way, and it lets me check cranial nerve 9 and 10, which work with your uvula. If your uvula is going to one direction or the other, that's also a concern. You stick out your tongue and move it from side to side. Thank you very much. That looks great. So what is it that you're hearing? You said that you're kind of hearing some different things. Well, your ears look good. Do you have, can I do a quick neuro check on you? Can you follow my fingers? Perfect. Does this feel the same on all sides? Perfect. Yeah, just right here, and here, and here. Okay, that's perfect. That's just fine. Can you go ahead and shrug your shoulders against my resistance here? Perfect. Can you go ahead and squeeze my fingers? Perfect. Can you go ahead and lift your hands up? Good, and out, and in. Go ahead, lift this knee, and lift the other knee. Okay, and then kick this foot out. Gentle, and kick this foot out. Perfect. Okay. Have you been seeing things or hearing things that other people can't see or hear? No, it's just some of these sounds. Do you like them? Are they kind of relaxing, or are they super annoying? Okay. Did you have a recent, big fight, like a tinnitus? Is a very likely possibility if you're hearing. What are the sounds in your ears like? Oh, kind of like clickings, tappings, whooshings, things like that. Okay. Does it change when you turn your head? Here, if I turn your head this way and that way, or if I press on your neck here, does that change? Does that change the sounds? No, that's good, because we want to make sure. Sometimes it's different sounds and it's not pulsing. Good, because different sounds can sometimes be a sign of some kind of occlusion in your carotid artery, but that's very unlikely in someone as young as you, and you hear it on both sides. Perfect. And last time you had a fight with Dr. Robotnik, was there a large explosion? Yeah, there was a large explosion. And is that when it started? Okay, so you are having maybe some just very unusual hedgehog tinnitus. Okay, well, what we can do is I can get you some nortriptyline. How would you like that? Nortriptyline. So nortriptyline was found in one randomized controlled trial of 100 people at the University of Texas to be helpful in controlling tinnitus, and it can just kind of dampen things a little bit, and it may help with some of the distraction as well. let's take a lot of nice deep breaths then. Let's take a lot of nice deep breaths in your nose and out your mouth. And what you'll do is you'll listen. I'm going to keep prescribing you this nortriptyline. I'm going to prescribe you this nortriptyline. You're going to start taking it. You're going to start listening to good white noise. Good white noise. Maybe you would say ASMR on YouTube, okay? Yeah. There's a bunch of different checks that somebody can do. Another thing that I'd like to check. Can you hear this okay? Okay, on this side, can you hear this okay? Okay, excellent. Very well done. I'm glad that you can hear so well. I'm very glad. I'm happy for you. I think you're gonna be okay, buddy. I think you're gonna be okay. Was the explosion scary? Okay. Oh, you were worried that you might lose your friend, and that's never happened before. So tinnitus does get worse during times of stress because our neurotransmitters start to overactivate, and what's happening in tinnitus is the little hairs are tingling. They're moving, and they're making sounds because that's how you hear. How you hear is when sound waves come and they hit your little hairs in your ears, and they wiggle, and that wiggling opens up different sodium channels up here, and then that information is transmitted all the way down the nerve up into your brain, which isn't very far away from your ear. It's not that far. Okay, so, but if those little hairs move on their own, it's going to transmit sound signals even though there isn't any actual sound, right? So that's the problem. That's what happens. And when we have a lot of stress, a lot of neurotransmitters buzzing around here, it can make it worse. That's why nortriptyline, which is technically a tricyclic antidepressant, sometimes can help with tinnitus. However, it does have a lot of side effects. I don't recommend giving it to older people. It is part of the Beers criteria because it can have some anticholinergic side effects. So if you find that you have difficulty urinating, or you find that you are becoming much more emotional, much more depressed, any kind of suicidal, homicidal ideation, any kind of thing like that, then you need to discontinue use and come back and talk to me about it. And of course, always remember to consult your actual hedgehog doctor in meat space where you are. This is just kind of a special little thing, mostly for your own education. Yeah, you're going to be okay, Sonic. You're going to be just fine. You are going to be just fine. I find that if I go a little bit faster for speedsters like you, it kind of makes you feel a little bit more comfortable. Don't you feel a little bit more comfortable than when like people are talking really slow, and it's a little bit annoying. How slow people are, and then they don't really fill in the spaces, and there's these awkward pauses and everything else like that. Yeah, it's like you gotta go fast, man. You gotta go fast. That's just what you got to do. So I'm pretty happy with your cardiovascular status because it is your yearly checkup, and because you do have, other risk factors. I think it might be a good idea. Get some labs, just a simple A1C, CMP. The reason for that is I want to make sure you don't have any unusual electrolyte imbalances, and we'll just get a CBC because anemia can sometimes also mess with this stuff. It does sound like you've been eating really well. You've been eating a super healthy diet despite living with very fat humans. So, I think that's pretty good. I wouldn't normally draw these labs like yearly for somebody, but just because you are having the tinnitus, I want to make sure you don't have any electrolyte imbalances. I'm also going to rule out a vitamin B12 deficiency as well. Okay, so those are the labs that I'm going to get. Did you have a loss of consciousness during the explosion? No. Any head injury? No? Okay. So we will try the nortriptyline. So that's the first thing. So we've taken care of pretty much taken care of the tinnitus. We've kind of done a quick cardiovascular overview just to make sure you're okay. Your neurological system seems to be pretty good for this kind of quick visit. If you notice any red flag signs, any drooping, any muscle weakness where you're not able to control the movement of your muscles, or your arms just kind of droop down, and then you cannot lift them up, or your legs are drooping and you have musculoskeletal weakness. Any other red flags, like you find that you're having urinary retention, you can't pee, you can't go to the other bathroom, no number 1 or number 2, or you find that you're losing complete control of either of those are all red flag signs, looking for some kind of spinal injury. And then of course for brain injuries, if you're finding that you have intractable headaches that won't go away and they're just really worse ever since the onset of that event, or you're finding that your mood and your personality are changing dramatically, please come back and talk to your physician. Sometimes it can be because of a physical impact that's altered some of the neurochemistry of your brain. It just alters some of the neurotransmitters and how they're released and everything else like that. But there are other things that can alter that. Sometimes they alter because of the diet we're having, because of the lack of exercise, or because of something that somebody said. Not that when something physical thing. Your different neurons are changing, or if you have been taught kind of unhealthy thought patterns, that can also cause like a physical change. Now that doesn't mean that we need to be really sensitive. I know you're not. I know you're a very tough little man, but that doesn't mean that, you know, if somebody says something that hurts our feelings, we need to blame them and sue them for causing us a depression. That's not really how that works. Depression isn't caused by other people. It's your body's response to something, and you can change your body's response. You can change your body's response. Nobody makes you do anything. You have control over your behavior. It's just that it's tough, and sometimes your brain doesn't want to let you have control over your behavior, and so it's this big mix between self-determination and the challenge of neurochemistry predetermination, right? Because you can't control what brain injuries you've had. You can't control how much your mom smoked while you were in utero. There are a lot of things you can't control. I'm not saying that your mom did, but there are a lot of things that affect your brain that you can't control. But you can control what you can control, and so you can be happy with that. Let's talk about the ADHD. I have a really good book here. Really good integrative medicine book. So the first thing we'll want to do is we're going to want to send you home with some Vanderbilt scores. That's these. I'm just going to fill out your information here real quick. So I'm going to have you take these home. This is a couple of surveys. You need some for the people at your work. You need some, so like I guess other people you have missions with. Who do you have missions with? Yeah, so I guess the echidna, he can fill one out for you. The little pink one, she can fill one out for you too. Basically about like how your functioning is affected and your parents, or, you should have at least 3 surveys from 2 different settings. Yep. And then bring them back to me. We can help with your ADHD diagnosis. Usually that's the diagnosis we use for children. You're kind of interesting because the way you age is particularly, hedgehoggy. There are adult ADHD criteria, which are slightly different, but we'll go over those on the next visit, on the next visit. But in the meantime, did you know? And I'll just show you here. There are a number of things you can do to help your ADHD. There are, and I have just this beautiful integrative medicine textbook. Obviously, if we need to medicate you, we can medicate you if it's becoming severe enough that you're having a ton of difficulty at work, difficulty saving the world. Certainly, no shame, no foul on being on an amphetamine. We can certainly do that for you. Certainly get you on a nice amphetamine. It doesn't have to be Adderall. And yes, these can cause you to lose weight. So you need to continue to eat. There are a number of other things. Okay, listen to this. Cerebellar dysfunction has been implicated in ADHD. Exercise increases brain-derived neurotrophic factor levels and enhances neurogenesis, thus promoting overall cognitive function, including attention and memory, which are both required for academic achievement. So, I would recommend a minimum of 30 to 60 minutes of aerobic activity daily, just for general and physical health, but also because a 2009 study in children with developmental coordination disorder found that regularly playing table tennis was helpful both for the coordination and their ability to sustain focus. That doesn't mean, I don't have a study that I've seen anyway that particularly says that exercise will cure ADHD or something like that, but it will help. And so, since you're already exercising a lot because of your job, that's good. So, listen, low levels of omega-3 fatty acids are linked to ADHD and behavioral problems in both adults and children. Supplementing with fish oils, which are rich sources of omega-3 fatty acids, can alleviate ADHD symptoms and decrease depression, anger, anxiety, impulsivity, and aggression. It can also improve academic achievement. All the flaxseed, walnuts, and green leafy vegetables contain omega-3 fatty acid. Linolenic acid. Humans convert only 5 to 10% of linolenic acid to the useful icosapentaenoic acid and docosahexaenoic acid. Encourage patients either to eat sardines, salmon, or mackerel twice weekly, or consume 1 to 2 tablespoons of flaxseed daily, or consider a supplement containing between 500 and 2,000 milligrams of combined EPA and DHA. Did you understand that? Did you understand kind of what I meant by that? What I meant by that? You should probably start taking an omega-3 supplement. Are you taking an omega-3 supplement? No. You should start doing that. That might help. Also with some of these symptoms. But I think the difficulty concentrating is probably related to the kind of new and unusual hedgehog tinnitus and stress. So what you need to do, the other thing I'm going to have you do, is I want you to write out your feelings. Write out how the explosion made you feel. Write out your concerns for your friend. that is necessarily necessary for ADHD. The biggest recommendations for ADHD tend to be environmental modification and medication. Environmental modification and medication. However, because you had kind of a traumatic event and it's affecting you physically with the tinnitus, because of that, might be a good idea to talk to someone just to just 1 or 2 sessions. It can be for what we call an adjustment disorder or just an other unspecified life stressor event. You don't have to have the official diagnosis of major depressive disorder or anything else to just get help from a touch therapy. And like I said, I can get you to persona. But one thing you can do for self-care, I recommend that because I am not a therapist. However, you are welcome to come here and talk to me anytime. You are welcome to leave your problems in the comments. You are welcome to chat with me. I check every day, and I love to talk to you. However, I am not a therapist, okay? I am a physician who has treated mental health disorders, and I've treated ADHD as well, usually by medicating, but I am open to other options as well. Listen, caffeine improves attention better than placebos in certain studies, but not as potent as prescription medications. Some families find caffeine a useful substitute for stimulant medications. In addition to caffeine, green tea also contains amino acid theanine, which leads to a feeling of calm that can counteract the jitteriness some people experience with coffee. Coffee and tea contain variable amounts of caffeine, depending on growing conditions and preparation techniques. Side effects include insomnia, jitteriness, anxiety, palpitations, panic attacks, and dehydrations. And of course, coffee can be addiction, and it shouldn't be used as a substitute for regularly getting a good night's sleep. But you might give yourself a little bit of coffee in the morning, or tea. I recommend tea. Of course, I'm a little biased. I have my tea shop, tingles-tea.myshopify.com, Sonic, okay? You can go and get yourself a really, really healthy tea that is ethically sourced, because like you, Sonic, I really care about not abusing people or the environment. Ethically sourced organic tea. How is that? So yeah, tingles-tea.myshopify.com, and proceeds go to help fighting human trafficking. So you can do that. Caffeine and theanine both can help you with your concentration a little bit. Again, these are not substitutes for going to your physician and getting a stimulant medication if you need one. But if you don't need one, it can help a little bit. And again, your concentration and attention may be just a little bit off. We'll wait until we get these questionnaires back. We can't make the official diagnosis until then. But it may be just a little bit off because of stress. So what we're going to do is we're going to try to de-stress. And so what I was saying, a self-care technique you can do is that you can write down your feelings, how the event made you feel, and then the thoughts you're having and the fears you're having for the future, and write down the details about the event, everything that happened. And then on the next page, or next several pages, you are going to write down whether your feelings are based on reality. For example, if you feel like I'm never going to be able to save or help anybody ever again, that was such a close call, you write down, okay, evidence for and against that. Well, the evidence against that is you've helped a lot of people successfully in the past. This was a one-time thing, right? That's the evidence against, and you write evidence for, and then you see, like, was the thought true? And that can help you. That's called cognitive behavioral. It's a concept from cognitive behavioral therapy. Obviously, you need a therapist to do that, but this is a trick that you can do for yourself to help yourself feel better. To help yourself correct those bad neuron pathways that trauma can create. Get me? Feel me? Alright, cool. So that's what you should do. Other stress management strategies are gratitude. Develop the habit of listing 3 things you're grateful for before meals or bed. Count on it. Count to 10 before reacting to something, which I know is very hard. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. أنا أقول 12 something. I don't know what the last number is. 1, 2, 3, 4, 5, 6. I can only count to 6 in Japanese, apparently. I've forgotten all the rest of my Japanese. Because you probably should count in all the languages you know, just because you're going to count it in really fast compared to other people. So another one is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, right? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, right? For French. So you got French, Spanish, you can count in English, you can count in Japanese, probably better than me. What is it? No, that's Gee, what is 10? I don't remember. Do you know what 10 is? Yeah, absolutely, that's correct. So that's what you do. You just count in all the different languages that you know. Okay. I can't believe I can't remember how to count in Japanese. I should be shocked. Identify your early warning signs for stress. Tight muscles, faster breathing, red face, clenched hands, and light jaw. And of course, you tight jaw. Of course, you don't get red in the face because you are blue. You are very beautiful in blue. Very beautiful in blue. Rehearse. Anticipate difficult situations. Rehearse a role play before the situation. Okay. You might also try biofeedback, autogenic training, or sitting meditation, or moving meditation like yoga, tai chi, qigong. That might be tough for you. But it might be good. It might be good for you. So things to think about. Things to think about. Now, the Feingold diet does not ban sugar. Okay. In studies of children with ADHD who received the Feingold diet, 73% had improved behavior. Studies involving more than 1,800 children showed significant improvement in the children's hyperactive behavior on a diet free of benzoate preservatives and artificial colors and flavors. So that might be tough, right? There's debate about that. There's debate about, because there are other studies. So this book has its own biases, right? And I have listed all the actual study references in the ADHD video I did that you saw, right? You saw it, but you don't remember it. But all the references about the video actually sucks. It sucks from way back in ASMR. But the description has links to just all these really good ADHD resources, all these studies, and that's what I'm talking about here. So go there, and that's where you can see my sources all cited. Dehydration can impair attention. Mood. When was the last time you drank water? Okay. Yep, in a small study of first graders, ingestion of some water before taking a test led to better attention and greater happiness. Yeah, it was a small study. So the Feingold diet, you might eliminate artificial colors, artificial flavors, BHA, BHD, TBQ, HQ, artificial sweeteners, aspartame / trivia, neotame, and allotame. Artificial food colors significantly worsen hyperactivity for some people. The Center for Science and the Public Interest has called on the U.S. Food and Drug Administration to ban dyes linked to hyperactivity and behavioral problems. Calling to CSB, I would like to see banned are blues 1 and 2, green 3, orange 8, red 3 and 40, and yellows 5 and 6. Okay, I'm not making a political statement either way. You can eat those or not eat those, ban those or don't ban those. But here's the thing. You might try it because everybody's different. You might try avoiding those things for a little while, just letting your body really heal. And then if the norepinephrine after a couple weeks does not help with the tinnitus, you just come back to me. And we'll figure it out. Based on our evaluation here, I'm not seeing any red flags. Do you hear a whooshing? When you take a breath, does it change when you take a breath? No. Okay, good. That also helps rule out eustachian tube dysfunction, in which case you might need a referral to an AG&T specialist. So you don't have any evidence right now of needing referral to an AG&T specialist, okay? Because you don't have any evidence of a tumor. Your neurological system is great. You don't really have evidence of Meniere's disease. It really does seem like it's sensorineural tinnitus based on this trauma, and I think that we can hop on this quick. We can help with it, and you need to get a lot of sleep to try to let those little neurotransmitters heal. We can get your neurotransmitters back in order, and part of that is also dealing with the ADHD because you're a whole person, and the stress, because stress worsens your ADHD, right? You're a whole hedgehog, a whole handsome hedgehog. So let's start with that because that's a lot of things that we've already